Hello, I'm Dr. Greg Nzaba. Today I'd like to talk about liver disease, a huge problem in the United States that is getting more and more attention as one of the most leading cause of healthcare dollars. So the liver is a large organ on the right side of the abdomen. It has multiple functions, probably more than 150. It helps with clotting factors, particular proteins and hormones, and one of the biggest ones is it filters the blood for toxins. So when liver damage happens, the liver cells get irritated, inflamed, and there might be an increase of your liver enzymes in your blood work, and there can be other symptoms as well. There are different stages of liver disease. So the first stage is what we call hepatitis. That is a term that means that the liver cells are irritated, and you can see an increase in the liver enzymes. It's not overtly dangerous at that point, but it is a clue that something's going on. The next step is fibrosis. Fibrosis means that those liver enzymes the liver cells are irritated, so they start forming scar tissue. And that's not good because it can limit the filtration rate of the liver. The good news is both of those conditions are somewhat reversible if you stop the offending agent of the liver, and it can regress. The liver's got a great capacity to regenerate and take a lot of damage before it really has a problem. The third stage of liver disease is cirrhosis, which is really serious. That's where the liver is so scarred down, it gets very rubbery and small, and that is not reversible. And what that can do is it can slow down the blood flow to the liver, and that filters the toxins. Now when that happens, very serious problems can happen. The blood backs up so people can get fluid buildup in their abdomen called ascites. The belly gets huge, and we usually have to put a needle in and drain out all these liters of fluid to relieve the pressure. Another thing it does is it backs up blood into the veins of the esophagus. So you get varicose veins that are called esophageal varices. And if they pop and break, a patient can bleed a whole lot and possibly die. So when they get to cirrhosis, very serious. The last stage of liver disease is just frank liver failure and hepatocellular or liver cancer, both extremely serious conditions. At that point, there's really not much to do except supportive care. If they need diuretics to try to keep the fluid buildup down, that's what we do also. And the main treatment, honestly, other than treating the cancer, would be liver transplant. So what causes liver disease? There are several things. There's viruses, infections like viral hepatitis, hepatitis B and hepatitis C can attack, inflame, and cause everything we just talked about. Another condition is just alcohol. People drink a lot of alcohol, and all that alcohol eventually causes the same symptoms: cirrhosis, liver failure. There's also causes that have caught a lot of attention as of lately, something called NASH, or non-alcohol fatty liver disease. And this has, again, nothing to do with alcohol, but it has to do with people and maybe their diet and their weight. People who are obese and consume a lot of fat or greasy foods, all that goes into the liver and get fat deposits, which causes the inflammation and the scarring, and it can have the exact same outcome as if somebody who drank alcohol. There are other conditions, medical conditions, medications that may cause it, even some chemotherapeutic agents. So how do we treat it? First and foremost, stop the offending agent right away. So if you drink, stop. If you're obese and eat a lot of fried, greasy food, cut back on that and lose weight. Those are the main things to do. When it gets to the point of ascites, we consider draining the abdomen when it builds up fluid, put them on diuretics to keep the fluid level down. So identifying what the cause is and treating it right away can be hugely beneficial to a patient. I hope that clarifies a little bit about liver disease. Thank you.